This is a video demo showing how to perform rhythmic stabilization for a patient with frozen shoulder. This video is for the students in RMT program on the educational purpose. It is not for a patient with the condition. Please consult with your healthcare professionals before you follow the instruction in the video. The demo is on right arm. Rhythmic stabilization is a type of PNF technique that works well for a patient with frozen shoulder and frozen to thawing phase. Prior to use the technique, you need to teach your patient which movement of the arm is needed to resist against your force. The first pair of movement is abduction and external rotation of shoulder, and the second pair is abduction and internal rotation of shoulder. But all motions are done pain-free. Have your patient in supine position. With one hand, hold the patient's distal humerus. Keep in mind that this hand will resist abduction and adduction later. With the other hand, hold the patient's distal forearm above wrist. This hand will resist external and internal rotation of shoulder. When you are ready with good hand position, take the arm into the end range of abduction and external rotation of shoulder within pain limit and apply long axis distraction at glenohumeral joint by the hand holding the humerus. Ask your patient to do the first pair of movements, which are abduction and external rotation at the same time using submaximal force up to for 10 seconds. It should be done isometrically, so you need to resist enough not to allow any increased range of motion. Right after 10 seconds, ask your patient to do the second pair of movements, which are adduction and internal rotation up to 10 seconds. It is also done with submaximal force and isometric contraction. Make sure that there is no rest period between the two pairs of movements. Once two paired movements have done, have your patient's arm into further range available in abduction and external rotation and then repeat the paired movements again. The whole process is repeated as needed. After all done and achieved up to the desired range, ask your patient to use the arm into new range a couple of times actively. Instruct your patient some home care activities using the new range so that the patient can maintain the range till next session. This is all. Thank you for watching.